Welcome, doctors. Our lesson today is our last lesson in the nasal course in our syllabus. It will be about history taking of nasal disease and symptomatology. And this is Dr. Muhammad Jamil again. History taking in general. This is very important in every clinical course in medical studies. You have to know the name of the patient to get familiar with him, and the age, because there is lots of diseases that is age related. Sex of the patient is important because some diseases occurs more in male and some other diseases are more in females, and there is also diseases are strict males or strict females. And then you will take the main complaint of the patient in his own words. Let the patient complain, but don't let him go out of course in talking. Concentrate on his main complaint or what brought him to your clinic. After that, analyze the complaint to see the onset of it. Is it acute or chronic? The course, is it progressive, regressive, and its duration. And then you will analyze or ask the patient about other related symptoms. Then take the family history for such condition or other conditions, and then you must know if he's on medication or had done surgery before or hospital admission related to the complaint or not. And you should know if he has history of chronic diseases as diabetes mellitus or hypertension. So what are the symptoms of nasal diseases? We have nasal obstruction, nasal discharge, epistaxis, smell disorders, and headache. Before going to discussing the nasal symptoms, we should remember that any symptomatology you should think about congenital, traumatic, inflammatory, neoplastic, and others that can apply to any symptomatology in medicine. So by starting by nasal obstruction, we will think about, as we have two nasal cavities, right and left, we will think for nasal obstruction about unilateral or bilateral nasal obstruction. Unilateral nasal obstruction. Here we will think congenital, like unilateral choanal atresia, traumatic, like foreign body, inflammatory, unilateral acute sinusitis or unilateral chronic sinusitis, neoplastic, benign and malignant tumors. And then we think about others like the nasal septum, septal deviation, or the nasal polypi as antrochoanal polyp. Remember the previous lesson. Now this is a figure for choanal atresia. On the left side, this is a normal figure showing the opening of the nasal cavity or the opened choana, and on the right side you will see the bony obstruction of the choana. On the left side, you can see unilateral right choanal atresia, and on the left side you will see a CT scan showing the same patient. Unilateral nasal foreign body. Can you see it on the right side? Unilateral acute sinusitis. Here you can see on the left side, this is a normal sinus, aerated, and on the right side you can see infection filling the left sinus. Septal deviation. Septal deviation, it can be S-shaped with septal spare, C-shaped, dislocated, or thickened. All these can cause nasal obstruction. S-shape can cause bilateral nasal obstruction. Antrocranial polyp. Remember the previous lesson? Left figure is CT scan showing the polyp coming from the left maxillary sinus. And you can see the polyp on the right figure glistening. Bilateral nasal obstruction. Congenital. Again, bilateral choanal atresia. Traumatic like fractured nose. Inflammatory. Bilateral acute or bilateral chronic sinusitis. Neoplastic conditions. Large tumors pushing the septum to the other side. And if the nasal septum, the S-shaped, as I told you before, septal hematoma and septal abscess. Now we go to others like reactive, like allergic rhinitis, vasomotor rhinitis, and bilateral nasal polypi. And conditions in the nasopharynx like adenoid or nasopharyngeal tumors can cause bilateral nasal obstruction. Can you see the bilateral choanal atresia? Remember, bilateral choanal atresia is emergency. Here is a patient showing fractured nasal nose with deviated nose. Bilateral sinusitis. Large tumor. Nasal polypi. Adenoid. Can you see it in the nasopharynx? In nasal obstruction, we should ask about, or the analysis for nasal obstruction, we should ask about the onset, sudden or gradual, the course, progressive, stationary or intermittent, duration, the severity, is it partial or complete, the association of the onset with common cold, nasal trauma or allergic symptoms, the site, unilateral or bilateral. What are the sequelae of bilateral nasal obstruction? It will lead to mouth breathing, snoring, and maybe obstructive sleep apnea. Difficult suckling in infants. And a term called rhinolilia clausa. The letters M and N are pronounced as a P. Hyposmia or anosmia. Recurrent infection like pharyngitis, laryngitis, bronchitis, due to loss of warming, humidification, and purification of the nose. Second symptom will be the nasal discharge. Types of nasal discharge. It can be mucopurulent or purulent, bloody, watery, water with food, or crusts. Mucopurulent and purulent discharge. All the causes are the same as nasal obstruction. Any nasal obstruction will be associated with mucopurulent and purulent discharge. Now we go to epistaxis, which is bleeding from the nose. Watery, like CSF rhinorrhea, remember the previous lesson? Or allergic vasomotor rhinitis, early acute rhinitis, viral stage of common cold and early stage of rhinitis of edencymatitis like measles. Or we have excessive secretion of the lacrimal glands apart from emotions. Can you see CSF rhinorrhea dropping of watery fluids while the patient is leaning forward? Water and food. Can this happen? Yes, which is called regurgitation. It happens with perforation of the palate, like in syphilis and maxillectomy, or paralyzed soft palate in bulbar palsy and cleft palate. Can you see the perforated palate here? And this is a child with cleft palate. Crusts, like in atrophic rhinitis. Can you see the crusts on the right side? And the CT scan showing most absent turbinates due to atrophy of the nose. What causes unilateral nasal discharge? Mucopurulent and purulent discharge are the same causes of unilateral nasal obstruction. Or unilateral blood like epistaxis, watery, CSF rhinorrhea, water and food, the same, oromaxillary or oro and nasal fistula, and crusts if we have unilateral atrophic rhinitis, which usually iatrogenic due to total turbinectomy. In nasal discharge, you should ask about the onset, the association of the onset with common cold, nasal trauma for CSF rhinorrhea, allergic symptoms, watery and mucoid discharge, the course progressive in tumors of the nose, stationary in deviated nasal septum and sinonasal polyposis, intermittent in allergic rhinitis and vasomotor rhinitis, the duration, the nature, watery, mucopurulent, purulent, bloody or with food, and the smell or the odor. Bad smell in sinusitis of dental origin and atrophic rhinitis. The amount of nasal discharge and the relation of to head position and straining. Remember the patient of CSF rhinorrhea while he is leaning forwards. Epistaxis, bleeding from the nose. What are the causes? We have local causes and general causes. Little's area. Little's area is an area in the nasal septum which has multiple blood supply coming from the anterior ethmoid artery, the posterior ethmoid artery, the sphenopalatine artery, the greater palatine artery, and the superior labial artery. All these blood vessels will be collected in an area called Kettelbach's plexus. This is the most common part for bleeding or epistaxis due to the multiple blood supply. So, if you have local causes, which may be idiopathic, 90% from the Little's area, or traumatic, like nose picking, fractured nasal bones, fractured nasal bones, the septum, or fractured base. Fractured base, we mean fractured base of the skull. Surgical, after operations. Inflammatory, like acute rhinitis due to severe congestion, chronic specific rhinitis as syphilis, affection of the nose, or chronic non-specific rhinitis as atrophic rhinitis due to separation of crusts. Neoplastic or tumors, tumors of the nose and the sinus, benign as angioma or malignant as carcinoma due to erosion of blood vessels. Tumors of the nasopharynx, like nasopharyngeal fibroma, and malignant as squamous cell carcinoma. Anterior deviation of the septum due to exposure of the convex side causes dryness, irritation, nose picking, and bleeding. What are the general causes for epistaxis? High arterial tension or high blood pressure due to atherosclerosis, renal diseases, thyrotoxicosis, high venous tension, like mitral stenosis, heart failure, emphysema, pneumonia, whooping cough, and tumors of the neck and mediastinum. Blood diseases like purpura, leukemia, hemophilia, deficiency diseases, vitamin C deficiency, vitamin K deficiency in liver failure, and fever, like rheumatic fevers, exanthemata, typhoid, diphtheria, due to toxic capillarities. Drugs, salicylates, quinine, anticoagulants as heparin and dicumarol. Remember, bleeding from the Little's area is the commonest cause of epistaxis in children and adolescents. Sphenopalatine artery is the commonest cause of epistaxis in elderly. Treatment of epistaxis. This is very important. First aid. The position of the patient. Sitting with the head flexed and chin to the chest. Compress the Little's area from outside by thumb and forefinger for 15 minutes and apply cold compresses on the bridge of the nose to induce reflex vasoconstriction. Cotton wool soaked in adrenal, epinephrine, or any nasal drops introduced in the nose with the patient in the previous position. Can you see pinching of the nose for this child and the nasal pack for this man? After first aid, if the bleeding didn't stop, we will do anterior nasal pack. This can be done by a Vaseline gauze, 50 to 75 centimeters long and 2 centimeters wide, introduced in the nose in layers from before backwards and from below upwards, and this is left for 24 hours. Can you see the stages for nasal packing using the Vaseline gauze in layers? We can use also inflatable balloons or aerosol sponge tampon. Those are ready-made packs. Posterior nasal pack. This can be done using a Follis catheter, which can be used as shown below, or an inflatable balloon for posterior packing. Posterior nasal packing using a gauze sponge. This is an inflatable balloon with an anterior pack and posterior pack. By clinical examination of an epistaxis patient, you should detect the pulse To exclude shock, it will be rapid with shock. The temperature to exclude high fevers. The blood pressure will be low in shock, remember that, and high in hypertension. For patients of epistaxis, we should do the blood picture to see the hemoglobin, to see anemia, white blood cells to detect leukemia, bleeding time, coagulation time, and prothrombin time. Biopsy can be done in case of tumors or granuloma, and biopsy is contraindicated in angiofibroma if suspected. CT scan and carotid angiography done in males and teenagers with suspected angiofibroma. Curative. Locally, we can do a bleeding point cautery, surgical treatment of epistaxis if all previous measures fail to stop bleeding. We can do ligation of the anterior or the posterior ethmoidal artery, ligation of the maxillary artery via the maxillary antrum, transantral, or ligation of the external carotid artery, which is rare to be done. And it is done through a cervical incision. Submucous resection of the septum if the deviation is the cause of repeated epistaxis. Generally, as general measures, we will give the patient rest, sedatives, coagulants, vitamin K if prothrombin deficiency exists, vitamin C aids capillary wall integrity, and blood transfusion if necessary, and antihemophilic globulin in hemophilia. Now we will go to smell disorders. To smell, three conditions should be fulfilled: odoriferous particles which must dissolve in the mucus, healthy olfactory mucosa, free olfactory nerves and tracts to the center of the brain. Disturbances of smell. It can be anosmia, which is complete loss of sense of smell. It must be bilateral. It is often described with loss of taste because flavor is largely received by olfaction. Hyposmia is the diminution of the sense of smell. Causes of anosmia and hyposmia. In the nose, extracranial, causes of bilateral nasal obstruction as collapsed ala nasal, deviated nasal septum, polypi, hypertrophy of the turbinates, atrophy of the nasal mucosa, peripheral neuritis after influenza or exposure to gases. Cranial causes, fractured base involving the cribriform plate, or intracranial like compression of the nerve tract by frontal lobe tumor or abscess. And B, anosmia in tracheostomy is due to bypass of the nasal airway. Cacosmia. Patient himself perceives bad smell, like in maxillary sinusitis of dental origin, foreign body in the nose, malignant tumors. Parosmia. It is the perversion of the nose of smell, which means patient smells non-existing odor. It can be functional, psychosis, or organic like influenza neuritis, epileptic aura, or uncinate fits, which due to lesion of the temporal lobe of the brain. In smell disorders, we should ask about the onset, the association of the onset with common cold, nasal trauma, nasal obstruction, the course, stationary or intermittent, the duration, the presence of bad smell. Headache. The definition of headache is the pain in the upper half of the head from the orbit back to the suboccipital region. Pain-sensitive structures are intracranial structures like the dura covering the base of the skull, blood vessels like cerebral arteries at the base of the brain, circle of Wills, meningeal arteries, intracranial venous sinuses, cranial nerves. Pain conducting nerves are the 5th, 9th, and the 10th. Extracranial tissues has arteries and muscles. Virtually all extracranial tissues are pain sensitive. And the upper 3 cervical nerves. Causes of headache. We have primary and secondary. Primary, vascular like migraine, neurological or neuralgia, like trigeminal neuralgia and glossopharyngeal neuralgia. Secondary, like intracranial, raised intracranial tension, intracranial aneurysm, meningitis, brain tumors. Cranial, like petrositis, osteomyelitis, facial trauma, nasopharyngeal malignant tumors, or extracranial, like rhinogenic, ocular, dental, temporomandibular joint, temporal arthritis, and tension headache. As you see, there are lots of causes for headache. Migraine. It's recurrent attacks of unilateral, commonly severe temporal headache associated with nausea, vomiting, and photophobia. Its etiology is unknown, and there is positive family history. Clinically, we have a prodroma, which shows mood changes, depression, a few hours before the attack, followed by the aura, which shows diplopia, blurred vision, visual defects, few minutes before the headache, and then the headache, usually unilateral, temporal, maybe frontal, which is severe and pulsating. What to do? Prophylactic between the attacks, we can give a beta blocker or calcium channel blockers, and treatment we can give carbamazepine, which is tegretol. Neuralgic headaches. Unilateral, severe, sharp, lancinating pain. Paroxysmal, lasts for a few minutes, and the pain is precipitated or triggered by trigger zones. Pain occurs along the pathway of the corresponding nerve. In trigeminal neuralgia, pain is along the pathway of the trigeminal nerve, and the trigger zones are the gums, as in brushing teeth, or nasolabial in washing the face. Glossopharyngeal neuralgia, the pain in the tonsillar area, which refers to the ear. The trigger zone is the tonsils with swallowing. Rhinogenic headache. Traumatic conditions like fractured nasal bones, inflammatory conditions like in external nose, we have the frontal, the paranasal sinuses, acute and chronic sinusitis, neoplastic conditions like malignant tumors of the nose and the sinus, diseases of the nasal septum, septal deviation, septal abscess. As you can see, most conditions of the nasal diseases or paranasal diseases can cause headache. We have something called temporal arthritis, which is an autoimmune disease characterized by temporal headache in old patients due to acute inflammation of the superficial temporal artery, and it may lead to blindness. Tension headache. It's a feeling of a tight band around the head. It involves the forehead, the templates, and the occiput. It's a common cause of facial pain and headache, and it usually follows physical, mental, or psychic fatigue. Thank you.